Okay, today we're going to continue the muscles of the vertebral column. There is important muscle called erector spinae. Erector comes from erection, as you know. So erector spinae muscle, it's like three columns of the muscle. Includes iliocostalis group, longissimus, and spinalis. Okay, so you need actually to know the arrangement, like it's from like lateral to medial, because there's sometimes question about that. So which one actually medial, which one is lateral? So going from lateral to medial will be iliocostalis, longissimus, and spinalis. As we learned before, the origin will be various sites, including cervical, thoracic, and lumbar vertebrae, and ribs and sacrum. Insertion, various sites including occipital bone, mastoid process, cervical and thoracic vertebrae. What is the muscle action? Muscle action will be maintains posture, extend vertebral column, lateral flexion when unilateral contractions occur. Of course, the innervation, as I said, you'll be learn more about innervation and nerve in the next semester. But it's a good idea just to know, just in case. Posterior rami of the cervical, lumbar, and spinal nerves. Most of them like that, like even the semispinalis group, posterior rami of cervical and thoracic spinal nerves. Here, posterior rami of cervical and only lumbar. And the quadratus lumborum, the innervation will be anterior rami of the spinal nerve. Semispinalis, we'll talk about this before. Semi mean half, as you know, half. Spinalis, muscle that cover the spine of the vertebral column group. So it include actually semispinalis capitis, cervicis, and thoracis. Origin will be the transverse process of cervical and thoracic vertebrae. Transverse process of cervical and thoracic vertebrae. Again, if this is, so just to review the bone, okay, this is lateral view of one vertebra. This will be the spinous process. Spinous process. But anterior view, let's say if this is on, so usually it has two wings, and this will be the spinous process. This is spinous process, and this is the transverse process. Remember that, because bone, again, transverse process. Bone is very important. If you're comfortable while you're reading the origin insertion, that means you did a great job studying your bones. Okay, and the insertion of the semispinalis group would be the spinous process of cervical, thoracic vertebrae, and occipital bone. The spinous process, okay? What the muscle action? Extends head and vertebral column, lateral flexion of the neck and vertebral column when unilateral contractions occur. Quadratus lumborum, from the name itself, quadratus means it's quadri, like quadrum, like this. Lumborum, it covers the lumbar vertebrae. Insertion will be the iliac crest. What is the iliac crest? In the pelvic bone or in the hip bone, right? And the insertion will be the transverse process. Now, see, this is a transverse process, just for you to remember. So this is the body of the vertebra. There is transverse process and spinous process, okay? The transverse process will be L1, L4, and rib 12. Muscle action extends vertebral column, lateral flexion when unilateral contractions occur. So that means those muscle action what makes you walk straight in 2 feet, okay? That's why they call it erector, like same muscle action. Just take a nice look in this. Okay, this is the occipital bone, remember? One of the skull bone, this one in the back called occipital bone, okay? And this is a beautiful semispinalis capitis. Semispinalis capitis, the first one. And this is semispinalis thoracis. Cervicis, I'm sorry. That means cervical. He's still in the cervical range. You know, you have 7 cervical vertebrae here, and those the spinous process, by the way. Okay. And the semispinalis thoracis here, the last one. Those the semispinalis thoracis. Okay. As you can see, it comes from transverse process, go to spinous process on the top. Transverse process to spinous process on the top. Okay, the 3 muscles, the 3 groups, 1, 2, and 3, we call them semispinalis group. Semispinalis or semispinalis group. Again, remember semi-semester, it's half spinalis muscle that cover the spine. Okay? Beautiful. Now, this is a erector spinae muscle. This is very important muscle. Again, this is what makes you actually walk on 2 feet. And it has actually 3 groups of muscle. And from the name of the muscle, you can actually expect where it comes from. Where it came from. So like, for example, like iliocostalis, okay, ilio from ilium will be in the hip bone down here, right? Costalis will be the ribs, okay? So iliocostalis muscle will be go from the ilium up to the ribs. Longissimus, the second one, very long muscle, the name itself tell you, it goes like from all the way down to all the way up. Spinalis, muscle that cover the spine, the spinous process of the transverse process here, see? So there is always a question about which one medial. So from lateral to medial, iliocostalis, longissimus, and spinalis. So if there's a question which one is most medial, spinalis. Which one is most lateral of the erector spinae would be iliocostalis. Okay, and we have the multifidus. Those multifidus muscle. It's same idea. Coming from transverse process, from one vertebra, go up to the spinous process on the top. From one transverse process to spinous process on the top, called multifidus. And the beautiful quadratus lumborum, and this muscle, usually they use it a lot in the belly dance. I don't know, sorry about that. Okay, so this will be the rectus, mean it's straight, muscle fiber is straight. Okay, it's covered with a lot of sheet. You see this whitish sheet here? This is called rectus sheet. Okay, this is the umbilicus. This is like everyone, you can't miss this one, right? Everyone know what's this. And the linea alba here, okay, that's mean white line. Translation will be white line. Linea alba, not Jessica Alba, right? And so linea alba, this will be the white line. Rectus abdominis will be the straight fibers. Muscle go like this, the fibers go straight up like this. This when you have the 6 packs, hopefully. Okay, and transverse abdominis, see, the muscle fiber go in the transverse direction. External oblique, this is the external one, the outside one. And usually the fiber actually, it's oblique, and the fiber actually facing inside like this, but oblique. You see, it's not transverse like this, not straight like this. You know, when you put your hand in your pocket, both hands in the pocket, this is the direction of the external oblique. Okay, and of course we have the aponeurosis. Again, this is another aponeurosis. You remember aponeurosis, whitish connective tissue, and we learn about Glia aponeurotica, if you remember, right? The one in the top in your skull. this connecting between the epicranius frontal belly and epicranius occipital belly. Okay, and the internal oblique, this one beautiful muscle here. See the muscle fiber oblique, but it's the opposite of external. External go this way, internal go inside. Okay, so I give you an example. Like if you put your both hand in your front in your pocket, right? This will be external oblique. If you put both hand in your back pocket in the pant, will be the internal oblique. Just to give you an idea. Okay. Okay, just take few origin and insertion, right? So external oblique will be the anterior surface of rib 5 to 12, and the insertion will be anterior iliac crest and linea alba by aponeurosis. Anterior iliac crest in the hip, linea alba, we just saw the white line, and the aponeurosis that cover the abs or the abdomen. Action will be tenses abdominal wall, compresses abdominal contents, a trunk rotation. Okay. Internal oblique muscle, iliac crest. The origin will be iliac crest and inguinal ligament. The insertion will be the cartilages of the lower ribs, linea alba, and crest of pubic or pubis. That's part of the pubic bone. Okay. And it's same as external oblique. Same action. Transversus abdominis, the origin will be the costal cartilage of the lower ribs, iliac crest, and inguinal ligament. Insertion will be the linea alba, the white line, and the pubic crest from pubic bone, of course. And action compresses abdominal contents. Okay, and finally the rectus abdominis. The origin will be the pubic crest and pubic symphysis. Okay, and the insertion will be the xiphoid process of sternum and costal cartilage from 5 to 7. Hopefully you remember where the pubic crest and where the pubic symphysis, right? Pubic symphysis, this is the connection between the two pubic bone. Okay. Action will be flexes vertebral column, compresses abdominal contents. Okay, those group of muscle like levator ani muscle, this is very important muscle, especially for female. Usually when they age a little bit and get pregnant, usually they have the muscle weakness happen, and when they sneeze or something, they start to lose urine. This is because weakness in the levator ani muscle or the pelvic floor muscle. And there is something called Kegel exercise that they need to do. Anyway, this is very important muscle, but I'll go through like some of the origin and insertion, and I want you actually to pay attention and to study them. The origin will be for the levator ani. Okay, levator, remember from the last time, levator mean elevation, so elevate the ani, the anus. Okay, and origin pubis and ischial spine. The pubis and ischial spine. This is in the hip, of course, and the insertion will be the coccyx, tailbone, coccyx. Remember this. So if they ask you a question, which muscle has the only insertion in the coccyx, will be the levator ani muscle, because all the other muscle here, like coccygeus, for example, it's the insertion in the sacrum and coccyx. Superficial transverse perineal muscle, the insertion is central tendon of perineum. Bulbus spinosus, they will be for the male sheath root of penis into corpus cavernosa, and for the female sheath vagina and root of clitoris into corpus cavernosa. Okay, so levator ani, the only one has the only insertion be the coccyx. Okay, the other thing is there's always a question. So which muscle is responsible for the erection? Ischio cavernosus, right away. Ischio cavernosus and bulbus spinosus help with this, with the erection as well. Okay, as you can see, even the superficial transverse perineal has origin of ischial tuberosity. Ischio cavernosus origin will be ischial tuberosity as well. Okay, and the insertion will be pubic symphysis near base, and cross of corpus cavernosa of penis or clitoris. Muscle action, very important, as you know. So for the bulbous spinosus in the male, it assists empty of urethra and assists in erection of the penis. For the female, constricts vagina and assists in erection of the clitoris. Issue cavernosus, for the male, it erects the penis, and for female, it's actually erect the clitoris. All this muscle controlled by the pudendal nerve, and the levator ani pudendal nerve and spinal nerve S2 to S3. This is just to show you again the location of those muscles, but it's very important. This pelvic floor muscle, very, very important, especially for female. There is something called Kegel exercise, pelvic floor exercise, to strengthen those muscles, because by age and getting pregnant, those muscles get weak, and when you sneeze or something, you start to lose urine, which is not really good. Okay. Anyway, of course, I'm sure you can read this in your own, but I just want to show you the issue cavernosus muscle. This is actually helping with the erection, and pulpospinosus muscle for male and female. This is help with the erection. Okay. Now the beautiful lower limb exercise. Okay. Just few of them again, because this is gonna be really too much to memorize all these muscles, but of course it's good if you're gonna become like a physical therapist or a nurse or a medical doctor. You need actually to study the anatomy in details. So psoas major muscle, it's actually two, psoas major and iliacus. These muscles are two muscles, but we call them iliopsoas muscle, and actually those flexes your hip. So this will be the psoas major, okay, and this is iliacus, mean the muscle that cover the iliac or the iliac part of the hip bone. This actually one of the bony landmark you can touch and you can see in your own body. They're called anterior superior iliac spine. Okay. This beautiful muscle called tensor fascia lata, not latae. Okay, tensor fascia lata. See at the lateral side of the thigh, and the beautiful sartorius. This actually the longest muscle in your body, and usually you use this one to flex the hip and externally rotate when you want to cross your leg or not, or put your leg and cross it on the top of the other leg. When you sit down, this actually the action of the sartorius. This is the medial adductor muscle. Adductor mean it's actually bringing the leg toward the body. Add the leg to the body. Okay. Gracilis, beautiful muscle, helping the adduction as well. And actually, one of the most important muscle, we call it the quadriceps muscle. Okay, quadri mean four, ceps mean head. So the muscle with the four heads. Okay, it actually has four muscles. Okay, you have the rectus femoris. Remember rectus, what rectus mean? That the muscle fiber goes straight, rectus. Okay, rectus femoris muscle. Okay, and you have vastus medialis in the medial side of the leg. You have vastus lateralis. It's in the lateral side. It's inside. I'm sorry, you can see it from inside probably here. Let's see it from here. Vastus medialis, vastus lateralis, this one and this one. Okay, and vastus intermedius, along with the rectus abdominis, rectus femoris. So this is actually called quadriceps muscle, and as you can see, it has actually common tendon, big one, cross over the patella, and will be inserted here in the tibial tuberosity. This is the tibial tuberosity. We call this quadriceps muscle This muscle actually very important. If you strengthen this muscle, you will not have any knee problem. And actually part of the rehabilitation usually will be strengthening those muscle, the quadriceps muscle. Okay, iliopsoas again, this is the psoas major and this is iliacus, we call it iliopsoas muscle. This is the hip flexor muscle. This is the psoas major, this is iliacus, cover the ilium part of the hip bone. And adductor, see adductor magnus, magnus mean magnum, the big one, magnus, okay, and gracilis. This adductor muscle, you have the adductor brevis, adductor brevis, the small one, adductor longus, the long one, and pectineus. Okay, so these are the hip flexor that bend the hip or flexes the hip, and those are the adductor muscle that adduct the or the hip. The beautiful gluteus muscle that cover the back of the hip bone. You have 3 glutei, one called gluteus maximus, okay, and gluteus medius, and we have gluteus minimus. We're gonna see next slide. This just again, this is the gracilis, this is the adductor magnus that adduct the leg or the hip. I'm sorry, and you have semi. Okay, semi mean half, tendinosus, semi-tendon. I don't know why they call it this name, but maybe they saw it like semi-tendon. This is semi-tendinosus. Okay. This is part of the hamstring muscle. Hamstring muscle. You have semi-tendinosus and you have semi-membranosus. It's right here. Semi-membranosus. Half membrane. I don't know why they call it this name, but anyway, you have semi-tendinosus, semi-membranosus, and you have the biceps femoris. This is called hamstring muscle. Have long head and short head. This is the short head. This is the long head. Okay, these muscle called hamstring muscle. Okay, remember we had biceps brachia in the arm. Here in the lower leg we have the biceps femoris. That's mean cover the femur. Very important muscle, the hamstring muscle, semi-tendinosus, semi-membranosus, and biceps femoris, long and short head. And laterally you can actually observe the vastus lateralis, part of the quadriceps muscle. Okay, gluteus medius, gluteus maximus, what give the shape to the butt, and the gluteus minimus. Okay, this is a piriformis muscle, and this is the quadratus femoris muscle. This is very important muscle actually, and usually in the past they used to believe woman who has like big glutei muscle that is can give birth. That means she's strong. And this was the question why people are so fascinating about the glutei. In the past, there is like this belief that if there is the woman has, or especially the female, if they have strong or big gluteus muscle, that means they can give delivery to a lot of kids. I don't know. They used to believe this. Anyway, so just few. I'm gonna just take the psoas major. Will be the origin, intervertebral disc, bodies and transverse process of T12 to L5. Insertion be the lesser trochanter of the femur. Hopefully you know the lesser trochanter again if this is the femur. Okay. You have greater trochanter and you have lesser trochanter here. And this is the head, the neck, etc. Okay, so the insertion be the lesser trochanter of the femur. Action be flexus thigh at hip and flexus trunk at hip as well. Okay, gluteus maximus, the important muscle. Origin will be the sacrum, coccyx, and posterior iliac crest. The insertion will be gluteal tuberosity of the femur. Remember when we started the femur was a tuberosity here, a little bit. We call it tuberosity. We call it gluteal tuberosity. This will be the insertion of gluteal muscle. And iliotibial tract. Iliotibial tract. And the action will be extend the thigh at the hip. Gluteus medius help with the abduct and medially rotate the thigh. Gluteus minimus, same as gluteus medius. So the only one out of glutei who extend the leg or the hip will be the gluteus maximus. The other two abduct and medially rotate the thigh. Sartorius, the long one, anterior superior iliac spine, and insertion will be the proximal medial surface of the tibia. Action B flexes, abduct, and laterally rotate the thigh at the hip and flexes leg at the knee. Some of the leg muscle, not all of them, because I know that's maybe you're overwhelmed now, but just try to take one by one and repeat them. It's gonna be easy after that. So tibialis anterior, tibialis, LIS mean muscle that covers the tibia, anterior muscle from the anterior surface. And again, when you see anterior, expect we have another tibialis, will be posterior, right? Fibularis longus, fibularis mean muscle that cover the fibula. Longus mean long head. We expect if you have fibularis longus, you're going to have fibularis brevis, short one on the side here, okay? And extensor digitorum longus, same thing at the upper limb. Remember the upper extremity, same thing. Extensor digitorum longus mean this actually extend your digit or your fingers, and it's long. Goes all the way here. Extensor hallucis longus, remember, hallux mean your big toe. Big toe, called hallux, the big toe, right? Like the thumb, called pollex. Remember, extensor pollicis longus in the thumb. In the lower limb, you have extensor hallucis longus. That means this is the muscle that extends your big toe here. Okay, and when you see this extensor retiniculi, it's exactly just you holding those tendons and muscle in place. It's exactly when you have multiple pins and you just want to wrap them with elastic band or something like that. Okay. Here, this is selected individual muscle here. Will be the extensor, hallucis longus, and fibularis tertius. Okay, go to the other side. Gastrocnemius and soleus, very important muscle. We're gonna come to this. Okay, from the back, see gastrocnemius, this big bulk, lateral and medial. Beautiful muscle, gastrocnemius, and have one common tendon here, calcaneal tendon, the biggest tendon in your body. You can actually touch in your foot and back of your foot. Fibularis longus and fibularis brevis. Lateral view, biceps femoris, vastus lateralis. See, this is the back of the thigh. This is part of the hamstring. This is part of the quadriceps muscle. And this is the head of fibula. Gastrocnemius muscle here, the bulky muscle. Soleus at lateral view. Okay, and the fibularis longus is right here. Extensor digitorum longus, muscle that extend your digit. And fibularis brevis, the short one. Fibularis tertius, the smallest one. And you have the calcaneal tendon here. And this is fibular retiniculum. Again, this is actually what holding some of the tendon together. Same like extensor reticula here. See, like when you use rubber band to hold few pins together, same thing. And this is the metatarsal bone. Okay, just few. Tibialis anterior. Origin will be the lateral condyle and proximal tibia. Insertion will be the medial cuneiform and metatarsal one. Action will be the dorsiflexion and inversion of the foot. Okay, the last part will be actually the surface anatomy, and we do it by palpation. So you need to do when you do the palpation, actually you know where is some of the bony landmark in the body. So for example, if you go down a little bit here, you have the sacrum, last part of the spinal of the vertebral column. You see this arch here will be the iliac crest of the hip bone. A little bit on the top, you're going to find the L4 along with the iliac crest. L4 lumbar 4. Okay. Of course, the trapezius inferior here. You have the inferior angle of the scapula, so you can see it even inferior angle of the scapula. You have the trapezius the middle, and you have the trapezius the superior part of the trapezius. C7 or cervical 7 is easy actually to locate. If you bend your neck, you're gonna find the spinous process of C7 here. Okay. Mark. Same thing here. See the zygomatic arch in the face and frontalis muscle or epicranius occipital belly. Frontal belly. And you have the mandible, and you have the hyoid bone right here. And this will be the laryngeal prominence or Adam apple, okay, of thyroid cartilage. Same thing, zygomatic arch, external acoustic meatus, allow the sounds to enter the ear. Temporomandibular joint, this joint is very important. Some people actually dislocate this. It's very painful, very, very painful, okay. And sternocleidomastoid muscle, trapezius superior, back of your skull, external occipital protuberance. You have the occipital ridges, back of your skull. You have the mastoid process right here. You have the vertebra, prominence of C7. I told when you bend it, you can find it easy here. Trapezius superior, the muscle. Acromion of the scapula. And the bony landmark and like surface anatomy that you need to know. Sternocleidomastoid again. Sternoclavicular joint. Supraclavicular fossa mean depression, as you know, and this is jugular notch of the sternum. Clavicle or collarbone. Acromioclavicular joint, between acromion of the scapula and the clavicle. Of course, this is anterior axillary fold. Biceps brachii, this is the axilla. This is the serratus anterior, linea alba, white line, external oblique, umbilicus, iliac crest, xiphoid process of the sternum, lateral view, acromion, trapezius, acromioclavicular joint, greater tubercle of the humerus, deltoid, the entire deltoid muscle. You have anterior, middle, and posterior portion. This is the kyphotic curve of the spine, and this is the posterior axillary fold, lordotic curve of the spine. This is kyphotic, and this is lordotic. This is normal curvature like this. Okay, biceps brachii, nice muscle here. Muscle with 2 head. Triceps brachii, muscle with the 3 head, muscle with the 2 head, and olecranon process of the ulna. Okay, so this will do it. There's some exercise you need to do. Okay, good luck, and if you have any question, let me know, and we shall show you some of the video of the muscle action later.